I should start with this case. And this case is a case which has been treated conventionally, probably beyond what one would do conventionally. This patient was referred to me with regards to a problem associated with this black triangle disease. On this slide is a white triangle disease. However, as you can see, he's got a high smile line. Patient has had an iliac crest bone graft to augment this site, an iliac crest bone graft to augment a single incisor site. Right? Talk about overkill. And then the patient ends up with an implant in the upper right central incisor, and that, ladies and gentlemen, is the outcome. Right? And that is clearly an aesthetic disaster. So he was referred in to try and do something about this area here. And clearly we can see there has been recession around here. There is bone loss associated with that central incisor. There is nothing that we have in our armamentarium today that can rectify this problem. And if there is one message that I want to send out today, because whatever I'm going to talk about today is only and only going to work if we get our implants in the correct three-dimensional position. So that's the first message of the day from me, is everything will work only if your implant is in the correct three-dimensional position. And you'll see this implant is way beyond its buccal envelope. And the only way to treat this case, there was no way I could have got this papilla back. And we had a frank discussion with the patient about what was possible to be achieved. And we agreed that we should try and restore this and try and at least get these teeth at the same sort of level. And if you look at the scan of this patient, and you will see the implant is going in that direction, the restoration wants to go in that direction, and there is quite a lot of bone missing on the labial of the implant. And there's only one way to treat this patient today, and that is by removing the implant and explanting the implant. Because when we take the crown out and we look at the abutment, you can already see where the problem is. Look where the screw access hole is. And we removed the abutment. The implant is still in place. I've placed a provisional resin-retained bridge. And this was an opportunity to try and assess and analyze with the patient if the patient would be happy with that outcome. And he said that would work, and accepting the black triangle here, but trying to get everything else correct. And that is achievable. That is what we can do. But look where the restoration needs to be and where the implant is. And that is the primary problem in this case. So no matter how much bone and which type of bone goes in, if our implants are not in the correct place, we have a problem. And as it heals up over a 4 or 5 week period, there is the implant opening, and then we go in to explant this implant. And you can see how buccally this implant is placed. You can see the effects of a buccally positioned implant. There will never be any bone buccally on that implant. These days we have techniques where we can literally unwind implants very minimally in terms of invasiveness without damaging what is left there. And then we go in to replace that implant in the correct three-dimensional position, getting the implant back into where it needs to belong, a screw-retained type of restoration. And I am not compromising the position of the implant. I am looking at this tooth here. I'm looking at the interdental bone, because that is what is going to guide our outcome. And then we go in with the technique using the regular GBR, and that is the outcome for the patient. And I think what we had set out to establish in the beginning was to get this level right. In fact, we probably overcorrected it slightly. The papilla was never going to be regenerated in this case. So this is a case of an iliac crest bone graft, and how things can go wrong and how we need to correct things these days. Now, moving on, if you look at the CBCT scan of the same patient now, we now have beautiful bone re-established buccally and has been regenerated using the particulate bovine bone graft.